Meet James Messerly, DO, a primary care and sports medicine physician with Bone and Joint. Dr. Messerly is board certified and has been with Bone and Joint since 1995, treating patients with musculoskeletal conditions.
I grew up in northeast Iowa, near Cedar Falls, Waterloo area. Then my wife was in the military, and we traveled to Washington State, Seattle area, where I trained in primary care sports medicine. And then we spent 3 years in Germany working with the Army medical division over there, and then finished up at Fort Campbell. And then I started a family practice residency here in Wausau, Wisconsin in 1992. And following that, then I accepted a position at Bone and Joint Clinic, so I've been at Bone and Joint since 1995. Well, at Bone and Joint, they seem to have the right approach to sports medicine. They were active in the community, active on the sidelines of football games, and covering hockey games, basketball games. And I think that's always important to have medical providers, especially at football, where there's a higher risk of injury, and more often than not, we're evaluating injuries on the sideline along with the athletic trainers at the high schools. Well, I enjoy living here in Rib Mountain. We moved here a couple of years ago, and just hiking and jogging the trails is just a wonderful place to live and grow up. I'm excited that Bone and Joint was part of the trail walking up Rib Mountain, and was a big part of that. I'm very proud to be a part of that too. I think that's an excellent activity, physical activity for the community to do and to help them stay in shape. Frequently, patients will call up with either acute low back or neck pain or chronic low back or neck pain. And so I frequently evaluate those conditions from a primary care perspective and try to talk about some rehabilitation exercises, physical therapy techniques that they might be able to do to control their pain, evaluate MRI scans, and then see if they are a candidate, if they don't respond to some of those more conservative measures, rehabilitation, and some other medications that might be available for their pain, then they may be a candidate for some injection therapy with our pain management specialists, and they would be referred to them. And then ultimately, if they would need surgery, then they would see our spine surgeon. But for the most part, we're always excited when people get better, when they can do their rehab exercises and learn to manage their painful condition on their own. I really believe that Bone and Joint does go the extra mile with that care, and so I'm very happy to be a part of that. It's a lot of work. Every patient that we see is in pain, and we still want to continue to try to help every patient that has pain.
Schedule an appointment with Dr. Messerly by calling 800-445-6442.